There are tens of thousands of farmers here at Field Days in Hamilton, and while many of them are feeling good about the state of the sector with record meat and milk prices, mental health is still a big issue. Suicide statistics are disproportionately high in rural areas, and many people struggle to access help.
Our largest proportion of referrals is for, distress, so from mild through to acutely suicidal. There's greater risk factors in the rural sector that unfortunately, huge workloads and isolation and just lots of pressures really, and work and home are all wrapped up in one bundle, so lots riding on it for people, I guess.
It's amazing how it creeps in. It affects your farm, it affects your family, affects your entire life, as you can imagine. So I often describe it creeping in like a fog. That's what it does. And all of a sudden you find yourself in a bit of a mess and you need a bit of help to get yourself out.
How did you get yourself out of it, and what are your tips for other farmers?
I had fantastic support. My wife in particular wrapped around me, which was amazing. But some of the key for me was actually getting off farm, seeing that there's a bigger world than just on farm. It's about connecting with friends again, learning new things, spending time with the kids, and ultimately just smiling a bit more.
And do you talk to farmers that are in similar situations to what you were in?
Yeah, a lot of farmers reach out and say, hey, I see what you've been through, how'd you get out?
This week the government announced a $3 million funding boost for the Rural Support Trust to improve access to mental health services.
We're immensely grateful for the increase in our funding, and it's going to mean that our rural people are better supported because we're going to be able to deliver our core work, which is that one-on-one, and it's free, it's confidential, it's impartial, and it's at a time and place that suits them.
What kind of demand is out there from the rural sector for mental health and wellbeing support?
100% of our cases have a mental health component. Our rural people not only struggle to ask for help on a day-to-day basis, but actually don't ask for help very often for their own well-being.
But while the new funding is being celebrated, there are still concerns about a shortage of specialists in rural areas, such as clinical psychologists.
We need more people that have some clinical training that can be attached to rural support or do outreach services. But on a rarity, I guess, having a clinical psychology background working on the coalface at rural. There are people splattered around the country, but there's no specific channel to train in rural mental health currently.
We're putting a lot of money and funding into healthcare. The good news is that we've actually grown our doctors by 200 and our nurses by 1,700.
But will that actually end up being in rural areas?
Yeah, so we made good progress on the absolute workforce, but you're right, we've got challenges in parts of rural New Zealand. We've also got challenges in other parts of our healthcare system, mental health and other areas.
Which is why farmers are being urged to reach out to their local Rural Support Trust.
They are absolutely saving lives. Keep connecting others when they see that they're battling, because we absolutely know it doesn't need to be like that, and there's always a path forward, always.